Joshua Nkomo's hospital hits another snag. The anticipated opening of the Ekusile Knee Hospital in Bulawayo, a brainchild of the much-loved late Vice President Joshua Nkomo, has hit yet another snag after government failed to meet the project investor in India as had been scheduled. This comes as the Indian investor, Sharda Group of Institutions, SGI, had started staff recruitments in preparation for the reopening of the hospital. However, Nyasha Masuka, the chairperson of the task force running the medical center, said they had no idea when Ekusile Knee Hospital will open its doors to the public following its closure 15 years ago. "We have not yet gone on the trip, we are not sure when we will be going. You can contact the permanent secretary for information," he said. Nkomo's son, Sabangalis, said the family was in the dark about developments on the hospital. "I have no information about the recruitments that are said to have been advertised in India. There has been no communication whatsoever about the project. For the past 17 years, this has just been an issue discussed in the press," Nkomo told the Daily News. Last year, he disclosed that government had turned down a potential South African investor, Clinics Health Group's proposal, in favor of the Indian investor whose authenticity had not yet been verified. Ekusile Knee Specialist Hospital was built in 2001 but shut down 3 years later after it was discovered that its acquired equipment, worth millions of dollars, was obsolete. The hospital has been undergoing renovations over the past 2 years due to the damage on infrastructure caused by termites and dereliction. Last year, President Emerson Mnangagwa made a spirited commitment to open the specialist hospital before year-end, pledging that he was going to make sure nothing would stand in the way of his efforts to bring fruition to Nkomo's vision. Finance Minister Mthiyelancube said the reopening of the hospital was way behind of schedule. According to Ncube, the hospital was supposed to have been running at the time set by Mnangagwa. Government had said the hospital would be opened in 2 phases to be rolled in 2019 and 2020. Phase 1 of the operationalization plan will begin in January 2019, targeting opening of the accident and emergency, outpatients and casualty units, among others. Phase 2, targeting opening of operating theaters, high-dependency unit, intensive care units, and dialysis, among others, is expected to commence in January 2020. This will be done under a joint venture arrangement between the National Social Security Authority, NSA, and an identified private investor. The private investor will contribute medical equipment, and carry out renovations to the health facility, as well as provide the medical services and linkages with local medical personnel, Ncube said last year.